Welcome to the Cardinal News of Virginia, a podcast from Cardinal News. We're a nonprofit news outlet covering Southwest and Southside Virginia at cardinalnews.org. I'm Dutchie Jessee. The Cardinal podcast is sponsored by 5 Points Creative, a full-service, award-winning marketing firm serving clients all over the U.S. from their headquarters in Roanoke, Virginia. And today we are talking with Cardinal's healthcare reporter, Emily Schabacker. Hi, Emily.
Hi, Dutchie. How are you?
I'm great, and it's great to have you. So thank you so much for joining us. You have been working on a project that explores the healthcare challenges faced by pregnant women in rural Virginia and in Southwest and Southside Virginia. How long have you been doing this, working on this project? Because it involves several pieces that have already published and that you've been working on for quite a while. So tell us a little bit about it.
I started on this project back in June, so it's been, quite a few months in the making. It'll hopefully be wrapped up by end of January, and I'm doing it in partnership with the University of Southern California Center for Health Journalism. I got to go to Los Angeles actually in June for a training for a week, and then they sent us back out into the world so we could start on our projects.
Yeah, great. So what you're looking at is specifically pregnant women in Southside, Southwest Virginia, and some of the challenges faced. So let's get right into it. For instance, one of the pieces that you've published has to do with basically a shortage of care available, like hands-on care. Is that right?
Right. So there have been, multiple labor and delivery rooms that have been closing down in rural Virginia over the last 10 years, and there have been a couple more added to that number just in the last couple years. And it makes it really challenging for women who are living in rural Virginia because they're having to drive very far for care. And when you're pregnant, you don't always know when you're going to go into labor. A lot of physicians have described it to me as that babies are not on a schedule.
Mm-hmm.
They come when they want to come, and sometimes it's in the middle of the night. So being really far from a labor and delivery unit is a little bit scary for a lot of these moms. And a lot of times, some of these moms are opting for induction, which, just because they're worried about the travel time to services. And so there's been an increase in doula care to try to kind of help bridge that gap, which has some positives and some negatives, like anything.
So what's a doula?
So a birthing doula, is someone who supports a mom through her pregnancy. So they are not medically licensed, so they can't provide advice on how to take medications or other things like that, but they are able to they talk to moms and can tell them if maybe they need to go to an emergency department or if they need to see their provider. Doulas are also going into prenatal appointments with these mothers, and sometimes are able to help explain some of the medical jargon. They're really just kind of a support system for these moms who are a little bit isolated from the healthcare system. They can tell moms to drink more water or help them identify some minor challenges with pregnancy, because I think that there's a lot of things that can happen that a lot of women don't know about, for pregnancy. So
who did you talk to with regard to this specific aspect of the series in terms of maybe a mom and a doula? And by the way, doula, I think a lot of people are familiar with the term midwife. Same thing, not the same thing?
Not the same thing. So doulas are like a lower level of care. Midwives technically can help deliver babies. Doulas are just there to kind of answer questions, provide emotional support, and can maybe direct a mom to go to the hospital or something if they need to.
So who did you meet for this part of the story?
Yeah. So I actually worked with Birth in Color, which is a nonprofit organization based in Richmond, that advocates on behalf of Black mothers across Virginia. maternal mortality is much higher among Black women, and it's even more challenging when you get into rural areas. So I worked with them to find a doula to talk to. And so I spoke with a doula who lives in Yanceyville, actually, in North Carolina, but she drives around, southwest all the way over to Roanoke, which is like a 3-hour plus drive, I think. And she has she had about like 4 clients a month that she would work with. Kind of had to stagger, you look at their delivery date and decide how many patients you can, or clients you can take in a month. She shared some really interesting stories. I met her at her house in Yanceyville, and we just sat on her porch and chatted for 2-3 hours.
And how'd she get into the field? I mean, how did she end up being a doula?
She didn't even know that like doula care was a profession that you could go into. But she said she has been essentially a doula for most of her life. Like, she had helped her aunts and her siblings through pregnancy, some sister-in-laws through pregnancies. And then all of a sudden one day she had heard about doula care, and she was like, well, I know how to do that. I already know how to do that. So she signed up for the training and became the doula for Southside, Southwest Virginia. And I think she's the only doula with birth and color in this region. They were hoping to train some more, but hadn't been able to get the training up and running.
Did you talk to any of her, is clients the correct terminology there? Yeah. And what did they say about the experience of having a doula? Yeah,
so I talked with Alexis. She lives in Rocky Mount, and she is working at the courthouse in Martinsville, but she was relatively new to that job and hadn't accrued like very much PTO or maternity leave. So she was driving to Roanoke for every prenatal appointment, which was an hour and 15 minutes, I believe. And she had to use her PTO time for that drive. So before she even gave birth, she had run out of paid time off because she was going to her prenatal appointments. And it was a real challenge when she did give birth. She took 6 weeks of unpaid time off from work. And she shared with me that she had saved up a bunch of money to try to make sure that they could get through those 6 weeks. She's a single mom, so this was her second child. But then her very generous coworkers kind of pooled some of their paid time off so she could take another 6 weeks. They shared that with her. So she was able to get 12 weeks off. But half of that was unpaid, and it was very uncertain for a long time. So
how does Virginia fare compared to other, or particularly this part of the state, Southwest and South Side, which is the area we're talking about coverage here, and some of the challenges for pregnant women in those locations? How does Virginia fare compared to other states? In other words, is this just a common problem that rural areas face pretty much everywhere, where there's just a lack of birthing units, delivery units that are still active in hospitals, and so they're facing these long drives and higher costs as a result?
So this is a very common problem throughout the United States. We've seen more and more labor and delivery units close in rural areas. So it is a national problem. I think when hospitals go through a financial crisis or are in financial strain, labor and delivery is often the first service that gets cut, and that's true for rural hospitals across the country. It's just they're very expensive services to provide, and then coming out of the COVID-19 pandemic, hospitals were in a lot of financial strain. There was a lot of financial difficulty, so that's kind of why we saw a couple more rural labor and delivery units close in the last few years.
Moving on to another part of this project that you've covered here, and that is, mothers or just moms-to-be dealing with drug problems and addiction issues. And you've covered that quite a bit, and I'm sure I've had some, a lot of eye-opening conversations with people about that. Let's get into that a little bit, about the problem of the difficulty of treating, complicated pregnancies like that, but also the social part of that maybe people don't say out loud a lot, which is some of the stigma that faces these women, and they're just trying to get the health care they need. So talk about what you found there.
Yeah, so when, a woman with a substance use disorder becomes pregnant, she's often reluctant to share that information with a provider, because a lot of times the knee-jerk reaction is to say, just quit using drugs, or why are you even using drugs in the first place? And for people who have a substance use disorder, it's just not that simple. It's a disease, and they can't just quit without the support. They're also very worried that social services will be called. They might already have other children that they could risk losing, or, they are at risk of losing the child that they're pregnant with at the time. And that's really intimidating. And I think a lot of women don't know that if you get help early in your pregnancy, if you're able to give birth to a baby that doesn't have drugs in its system, you're more likely to be able to keep that child in your custody. And then the other thing is that sometimes these women just aren't ready to stop using drugs. You got to be ready and willing, and that time comes at different phases for everybody.
Who did you meet when you were researching this part of the story of the project in general?
Yeah, I spoke with a woman. Her name is Miracle, and she lives in Buchanan County. She's actually from Oakwood, which is a small town kind of outside of Grundy. But we met each other in Grundy. She's 30 years old and has struggled with substance use disorder for a really long time. And part of that was because she didn't know that there were resources in her community to help her. No provider ever talked to her about it. And, she was kind of met with some judgment. And, she felt very much so that it wouldn't be a safe option for her to share that she was struggling with substances. So.
I would think in a rural situation where you have maybe 2,000 people living in a town versus 200,000 in another area, the stigma is, or the fear, the stress that you feel might be greater because people know you in your town.
Yeah.
You might feel a little bit more under the spotlight and more exposed in those rural settings, which of course aggravates the whole situation even more, because the stress and the fear are not healthy for your pregnancy either. So I also want to talk about someone you met who's a doctor who had his own experience with substance abuse and use, and you got to talk to him quite a bit. His name is Stephen Lloyd. Talk about him. How did you meet him, and what did you all talk about? What story did he share with you?
Yeah, so I was connected with Dr. Stephen Lloyd through Beth Macy, actually, who wrote Dope Sick, which has been turned into a Hulu TV show. And so she actually spoke with him for her book, Dope Sick. So when I started researching this topic and wanting to cover it, we reached out to Beth, and she provided some sources for me, and Dennis Lloyd was one of those sources. Or Stephen Lloyd, I'm sorry.
Yeah, no, you're good.
And so it was great because he was super willing to chat with me, and he's been sharing his story all over the country for quite a long time. But he started using substances while he was finishing up medical school. He was in his residency. And he started using substances and did so for a number of years while he was treating patients. And, got to a point when he realized that he had a problem and he really needed to get help. But being a doctor and being a man with some white privilege, he was able to enter rehab. He still got paid for the time that he was in rehab. He was away for 90 days. And, he never lost his job. And when he came out onto the other side of that, he realized that not a lot of people get that opportunity. They don't get to keep their jobs. They don't get to, leave their families for 90 days to go to rehab. And he really made it his mission. He, became familiar with the challenges, kind of in far southwest Virginia. He's actually spent some time in kind of like the Abington area, and as well as eastern Tennessee. And he really became familiar with this issue where pregnant women with a substance use disorder were getting no help. If it came out that they were pregnant and using drugs, like their whole lives were just derailed and destroyed. And he, he just thought that wasn't right. So he was actually pioneering this concept that like we need to have some sort of checks and balances in these areas. We need to have, screening for substance use disorder in these areas. And then we need to have ways to connect these women to help.
I wanted to quote something you wrote in your piece that includes Dr. Lloyd. You wrote, drawing from his own experience with addiction, Lloyd describes what he sees as two distinct systems of care in the United States, one for those with money and status, and a far more challenging, even sinister system for those without privilege. I mean, those are strong words, and he said them, but have you found that as you've been digging into this and meeting people on lots of different sides of these issues, have you found that to understand exactly what he meant by even sinister system?
Yes. I mean, I think that the time that I spent with Miracle,
and she's the woman who lives down in near the Grundy area, the mom.
I mean, she lives in a very impoverished part of the state. Before she got help, she was, living without heat or water at her home. And she was connected to services. The only reason she was connected to services was because she was arrested. And she had to spend a couple months in jail because she violated her probation. And this was kind of in the middle of her pregnancy. And it's disheartening to think that the reason she was connected to services was through the court program, when someone like Dr. Lloyd, was able to be connected to services just because of, his work and
his status.
And, he was able to pay for rehab, and that just would never have been an option for her. And, I think we're very grateful for the drug court system. But it is very harsh, and she did get the help that she needed eventually, but it took about over 10 years to get to that point.
We could be a little I guess pessimistic after you could, especially after digging in and seeing these stories and seeing firsthand, meeting people who are facing very difficult circumstances every single day of their lives. But I'd like to talk about what are some possible solutions, changes, whether that's having to do with funding in certain localities from the state or otherwise. Talk to me about reasons for hope when it comes to this general problem of struggles finding appropriate health care when you're pregnant in rural Virginia.
Yeah, that's a hard question.
Yeah. I didn't know if anything potentially was coming up or solutions talked about. What are some of the bright spots? Did you run into people who are able to provide help?
Yeah, well, I think it's heartening to know that the governor has proposed a significant chunk of change to go towards infant maternal health in his proposed budget for this year. And I know that there are a lot of organizations, grassroots organizations, that are going to be out there advocating for legislation that can maybe help close these gaps. I know Birth and Color does a lot of work around that, and they are preparing their legislative priorities for this year. And I think that there's a big push to get cultural competency and cultural bias training for providers, which is expected to really help with the mortality rates for Black mothers.
When you say cultural competency for providers, what I picture is you're in the office. The way the person you're dealing with treats you, whether it's the nurse who says, okay, he'll be right with you, or she'll be right with you, or the provider, the physician themselves, or whoever. Is that what we're talking about? Like, kind of like how we treat the patients, regardless of what we know about them. And you know, because as we referenced earlier, substance abuse is a disorder. But we're still trying to train people to understand that so that they take maybe some of the blame out. I don't know if that's the right word, or remove some morality from what's not being said out loud in the room, but maybe is thick in the room.
Yeah. So, you know, throughout this series, I talked to some mothers who shared their experiences in the doctor's office. And Kim Hunt, who works at Cardinal, is a peer support specialist, shared a story where she could hear the providers outside of the exam room talking about the fact that she was in early recovery, and people would say things like, "Oh, do you think you're going to stay in recovery?" And you know, things like that. And they can be really, it may seem like not a big deal to the provider, but when you are really deep in that kind of stigmatization and that shame, any little thing can be really impactful. And so Dr. Kim Simcox, who's also at Cardinal, she's an OB, she has really advocated for greater education around how we talk about substance use disorder, and particularly for you know, pregnant moms. You would think that those two worlds wouldn't overlap a lot, but they do. I mean, that is oftentimes the first point of contact for pregnant women in regards to their substance use disorder. So
interesting. Well, Emily Schabacker is the healthcare reporter for Cardinal News, and you can view all of her work at cardinalnews.org. You can look under the healthcare tab for that. Emily, if people want to get a hold of you either for this project or anything you're covering or anything they'd like to talk to you about, how do they reach you? What's your email?
Yeah, my email is just emily@cardinalnews.org.
Easy. Thank you so much for talking with us. Looking forward to talking to you again. Want to thank everyone for listening to the Cardinal News of Virginia. Also, thank you to Sherry Quinley and Zach Shelton for their help with the podcast, and to our sponsor, 5 Points Creative. Get more news from us at cardinalnews.org. I'm Dutchie Jessee.